Hello, my name is Eva Mbati, and I am a final year student on the MSc Counseling course at Bangor University. What we know is, for the most part, individuals seek therapy because they are experiencing a level of psychological distress. And if all goes well, by the end of it, that distress will have been alleviated. But what goes on in the middle? This presentation describes the process of trying to investigate just what makes therapy successful. This was done by looking at components of CBT and psychedelic-assisted therapy. I hope you enjoy, and if by the end you have any questions, do not hesitate to reach out. Thank you. Let's talk about the middle. How emotional breakthrough and psychological flexibility relate to client well-being post-CBT. According to the Mental Health Foundation, by 2016, nearly half of the adult UK population believed that they had, at some point in their lives, experienced a diagnosable mental health condition. By February of 2020, the rates of people reporting experiencing a mental health problem had doubled in size, resulting in a higher demand for mental health services, including talking therapies. Numerous psychological practices are housed under the umbrella term of talking therapy, each with their unique techniques and approaches to promoting the mental health and well-being of their clients. Cognitive behavioral therapy has been cited as one of the most sought-after, effective therapeutic approaches in the UK. CBT has effectively been used to treat depression and anxiety. However, studies suggest that CBT alone is insufficient in bringing about long-lasting recovery in individuals struggling with treatment-resistant depression, substance misuse, post-traumatic stress disorder, and obsessive-compulsive disorder. Research into the therapeutic properties of psychedelic drugs gained attention in the Western psychological field in 1943. This was followed by years of exciting, extensive research into the potential uses of psychedelics in treating a wide range of mental health conditions. The 1970s saw a halt in psychological research when the possession and use of psychedelics were deemed illegal in America. However, after 30 years, the early 2000s saw a re-emergence into the studies of psychedelics as a medium for therapeutic recovery. Psychedelic drugs paired with talking therapy, known together as psychedelic-assisted therapy, or PAT, have been used to successfully treat cancer-related psychiatric distress, such as anxiety and mood disorders, as well as treatment-resistant depression, wherein symptoms of depression are unresponsive to traditional talking therapy and antidepressant medication. PAT has also been used to successfully treat alcohol and tobacco addiction. Some studies have found that after a single high dose of psilocybin during PAT, positive well-being and behavioral changes have been seen to endure for up to 6 months following the treatment. Research surrounding what exactly causes psychological improvement in PAT clients is scarce. There is, however, evidence of changes in the temporal lobe, which is the part of the brain responsible for emotions and memory, as well as the reduction in activity in the default mode network, which is the brain networks responsible for self-consciousness and self-reflection. Following further research into psychedelic-assisted therapy, researchers isolated what may be an integral contributing factor to positive psychological change amongst PAT clients, and that is emotional breakthroughs. Emotional breakthroughs are understood as the process of facing a challenging memory or experience and overcoming that challenge. And it is in that experience that long-lasting positive well-being is formed. The active resilience that seems to underlie EBs, or emotional breakthroughs, are components very similar to those of personal psychological flexibility. Personal psychological flexibility is understood as the prevailing ability to achieve one's goals in the face of adversity. Limited research exists regarding the integration of the emotional breakthroughs and psychological flexibility in the use of talking therapies, such as CBT, and that is where this study comes in. With the wider hope of trying to understand just what makes therapy successful, this study specifically aimed to investigate whether there would be a relationship between emotional breakthroughs, psychological flexibility, and well-being scores. It also sought to investigate whether the mode of talking therapy, namely CBT, had a relationship between emotional breakthrough, psychological flexibility, and well-being scores. The first hypothesis was that there would be a positive correlation between emotional breakthrough scores and well-being scores. The second hypothesis was that there would be a positive correlation between psychological flexibility and well-being scores. Finally, the third hypothesis was that individuals who received CBT would report higher emotional breakthrough, psychological flexibility, and well-being scores. For the purposes of this study, respondents were invited to complete an online survey distributed through social media posts placed on Facebook, Instagram, and Reddit. The survey was also distributed in the January 2022 newsletters of the Psychedelic Society as well as the BACP. Respondents were also recruited through the School of Psychology's Student Participant Panel System at Bangor University, also known as SONA. The survey was presented in both English and Welsh, with the target population being UK-based adults who had experienced at least 6 sessions of counselling within the last 6 months. The study therefore included 75 participants with an age range between 18 and 63. The measurements used in the study included the Emotional Breakthrough Inventory, the Psychological Insight Questionnaire, and the Warwick-Edinburgh Mental Wellbeing Scale. It also included 8 single-choice questions designed by myself and my fellow researchers, which were used to obtain details regarding respondents' historical experiences and intentions using psychedelic substances. The results were as follows. When it came to emotional breakthroughs, on average, respondents reported feeling at least some degree of an emotional breakthrough during their therapeutic session, with an average score of 59.3 out of a possible 100. When it came to psychological flexibility, all respondents reported feeling at the least a slight degree of psychological flexibility during their therapeutic sessions, with an average score of 4.2 out of a possible 6. When it came to therapeutic experience, namely, how much of their therapeutic experience involved cognitive behavioral therapy, the largest percentage reported that at least some of their therapeutic experience involved cognitive behavioral therapy. A correlation analysis was done to see whether a relationship existed between these different results, and if it did, was it significant or not. The findings were there was no relationship between either the EBI, PIQ, or well-being scores and the amount of CBT involved in the therapeutic sessions. There was, however, a positive correlation found between EBI scores, PIQ scores, and well-being scores. In order to investigate just which variable had the strongest correlation with well-being scores, a partial correlation analysis was done. The findings showed that EBI scores had no correlation with well-being when PIQ scores were accounted for. PIQ scores, however, had a moderate correlation with well-being scores even when EBI was accounted for. The first hypothesis stated that there would be a positive correlation between EBI scores and well-being scores. The results of the study did not support that hypothesis. What was interesting is that item 3, which related to the feeling of being able to explore challenging emotions and memories, scored highest of the 6 items on the EBI. Item 2 and item 4, which related to feelings of resolution or closure, scored the lowest on average. Could this be related to the reason why people seek therapy in the first place? Studies suggest that people seek therapy because they are feeling alone, misunderstood, and trapped by negative thoughts and self-doubt. Perhaps their main goal is to try and alleviate those feelings, and finding resolution and closure may therefore be a byproduct of therapy, something that happens outside of the therapeutic relationship. The second hypothesis stated that there would be a positive correlation between PIQ scores and well-being scores. The results of this study supported that hypothesis. Other research has found psychological flexibility is linked not only just to higher well-being, but is also linked to higher levels of resilience, pain tolerance, perseverance, and an overall quality of life. Research has found that individuals with higher psychological flexibility also experience more self-efficacy, which is the belief in their ability to succeed in particular situations. This influences the ways in which people view not just the world, but themselves, and is an integral part of a person's self-esteem. The third hypothesis stated that individuals who received CBT would score higher on the EBI, PIQ, and well-being scales. The results of this study did not support that hypothesis. This may be due to a number of reasons. The first of which is that research suggests that one of the strongest predictors of positive therapeutic change is not necessarily the therapeutic approach used, but rather the quality of the relationship between the client and the counselor. Over the last 20 years, as therapists move to work with a more diverse clientele, there has also been a rise in both the popularity and the relevance of integrative therapeutic approaches. The results of the study found that of the 75 respondents, only 2 had received solely cognitive behavioral therapy. Another interesting point of discussion was a lack of correlation between EBI scores and historic psychedelic substance use. This was particularly interesting because emotional breakthroughs have been identified as a unique, integral component of psychedelic-assisted therapy. However, these results just may be indicative of the complexities of PAT. PAT involves more than just the ingestion of a psychedelic substance. It also involves the presence of a supportive and safe environment, as well as psychological support for clients before, during, and after the dosage. Another possible reason may have been found following a frequency analysis, which was run to ascertain the experiences of respondents who had taken psychedelic drugs. The results showed that there was a high mean score of respondents reporting feeling profound positive emotions, and the lowest mean scores were found for respondents experiencing challenging emotions. An integral component of emotional breakthroughs is the act of facing challenging experiences, and perhaps the low score of respondents who had experienced those challenging emotions may be a factor into the lack of correlation between EBI scores and historic psychedelic use. Although the study attempted to account for as many limitations as possible, some still existed. The first was a small variety of demographics represented in the respondent pool. This put the results at risk of being influenced by other confounding variables. The lack of an experimental approach to the study also meant that it was not possible to ascertain whether emotional breakthroughs, psychological flexibility, and well-being were directly influenced by therapy. There was also a large range in the amount of CBT respondents had experienced in their therapeutic experiences. This made it impossible to have an accurate comparison. What does this mean for future research, though? I believe that for future research, it may be beneficial for researchers to conduct an experimental research design in an attempt to test the cause and effect relationships between the variables of emotional breakthroughs, psychological flexibility, and well-being, as well as CBT. In so doing, I think that researchers may move a step closer to discovering and fostering the variables responsible for lasting, positive psychological well-being.